So, who are we? Well, we both work at Communicate Health, and Communicate Health is a health communication and research company serving a range of federal and state government clients, as well as for profit companies and some nonprofit organizations. And we like to say that we work at the intersection of plain language, health literacy, and human centered design. So, as you can see on the screen here, our mission is to improve lives by designing health information, products, and digital tools that are easy to access, understand, and use. Basically, we're all about helping make sure people get the health information they need and can understand that information so that they can make well-informed health decisions. And everything we're going to talk about today is central to that work. So, what are we going to talk about today? Well, we'll be talking about best practices specifically related to numbers and visuals in health materials. So, how can we make sure people understand numbers, which are often hard to understand? And how can we use data visualizations like charts and graphics in a way that helps people understand health information? Our goal is for you to leave today's session with some actionable knowledge that you can apply in your work. So our three objectives for today are that you'll be able to identify best practices for using numbers in health materials, think critically about how to use visuals to help people understand health information, and apply best practices to create clear data visualizations. I also want to note upfront that everything we'll be talking about today applies to health materials for just about any audience, but these best practices are especially important for people with low health literacy skills. And we'll talk about why that is in just a minute. But first, I wanted to kind of open it up to you all to reflect and share and get everyone participating. So if you don't mind sharing in the chat box something you're hoping to learn about in today's session, or a question you already have about using numbers or visuals in health materials. I'll give you all a minute to do that.
So to kind of get us all on the same page before we start going through some of these actionable tips we keep talking about, I just want to give a quick and very simple definition of numeracy, which is very relevant to everything we'll be talking about today, and of course is in the name of today's training. And we define it simply as how well people can understand and use numbers. That is a very simple way to put it, but it pretty much sums up what you need to know. And of course, many people do struggle with this. We'll be talking a lot about numbers today, and specifically the numbers that we often find ourselves using and communicating about in the field of public health. And while we are going to touch a bit on some just broad overarching best practices for using visuals in health materials, the second half of today's training, after we talk about numeracy best practices, is really specific to data visualization rather than any of the many, many other types of visuals out there like photos or illustrations, for example. So I just wanted to note that up front. We could give a whole other training on those types of visuals as well. But our main goals today really are to give you some concrete and actionable tips for helping your audiences and the people in your communities understand numbers and other health data that you need to share with them. All right, and I just have a nice key point slide here really quickly, which is that in public health, sometimes people need to understand numbers and data. And I just wanted to clearly state that up front. I think most of you know this already, but in the field of health communication, many people were actually taught to basically avoid numbers almost all the time because people struggle with numbers and we don't want to make it harder for them. But as you no doubt know, there are times when we cannot just avoid numbers in public health. It's true that we want to limit how many numbers we share. I'm not going to pack 3 statistics into a sentence, for example. That makes it hard for people to understand. If I am telling someone what a healthy blood pressure number looks like, for example, I cannot do that if I don't actually give them blood pressure numbers. Or if I am explaining the air quality index to them and what's a healthy air quality index and what isn't, can't do that without numbers, right? So that is why We cannot just avoid numbers all the time. But as I noted, many people do have low numeracy skills, meaning they have a pretty hard time or a very hard time understanding and using numbers. And this nice data visualization here, we'll talk more about these in the second half of today's training, but this data visualization represents people's numeracy skills. This is really showing what percentage of people are at each level of proficiency on the PIAAC numeracy scale. And that acronym stands for the Program for the International Assessment of Adult Competencies. And it is something that basically assesses people's skills over a broad range of abilities. And so this shows that only 9% of people are at the top 2 levels of numeracy skills. A full 10% of people don't even qualify at level 1. So those folks can count and probably do very basic math with whole numbers only. And then you got 20% of people at level 1. So that's a little bit higher, but still pretty basic math skills. So that kind of gives you an idea of what we're talking about when we talk about folks having low numeracy skills. All this, of course, matters because if people have trouble understanding the numbers in your health material or your health information, there is a good chance they'll have trouble understanding that health information as a whole. So in other words, their numeracy skills can affect their overall comprehension of a material or of some health content. And that really speaks to the connection between numeracy and health literacy, which we define as how well people can find, understand, and use health information. And plus there's the fact that the people who have the most trouble understanding numbers are also likely to just struggle with health literacy and literacy generally. So what can we do? How can we make it easier for them? Well, we can help them understand numbers and data by communicating clearly with words and also with visuals, like that data visualization. And when we do that, we help make sure they understand our health messages and materials. And the good news is that there are some established evidence-based best practices to help us do this. And we are just about to talk about those. All right. So I just want to throw this slide up really quickly, just to give an example of some health content that uses numbers in a pretty confusing way. So this is from a government fact sheet that is about older adults and the need to get a flu shot and how important that is. And in the smaller black text at the bottom, there's a sentence that says, in recent years, it's estimated that between 70% and 85% of seasonal flu-related deaths in the United States occur among people 65 years and older. And between about 50% and 70% of seasonal flu-related hospitalizations have occurred among people in this age group. It's a bad sign when you have to take a breath in the middle of a sentence. So it's too long of a sentence, but anyway, this is a pretty typical example of health content that's out there that people might find on the internet, that they might get in a fact sheet from their doctor's office, something like that. But that's a lot. That was 5 numbers packed into one sentence, a lot to take in. It's also percentages, which can be confusing for people, and we'll talk about that in a little bit. There's also the question of whether you need those numbers at all to get your point across. You might decide that you do need a number or 2 to get your point across, but maybe you don't. And if you can avoid having 4 or 5 numbers to make the same point, I would recommend doing that. But key takeaway here is that someone who has low numeracy skills might have a really hard time understanding that. All right, and I'm about to give these tips I keep talking about, but just quickly, I'm curious if anyone would like to share in the chat some examples of types of numbers or data that you do communicate about with your audiences or your communities, or you might need to communicate about. You just pop it in the chat. I'm watching. All right, so I have 7 tips for you to help you use numbers and health materials in a way that makes it as easy as possible for your audience to understand those numbers and to understand your health materials. All right, so the first tip I have for you is to carefully consider whether numbers are useful. So I've already talked about some times when you know you need to include numbers, but there are also times when you don't have to include numbers, but doing so can actually be very useful. And so in those situations, when you are trying to decide whether a number would be useful, the way to do that is to consider your communication goal And when I say communication goal, what I really mean is the purpose of your health material or your health content. So in other words, what is the key takeaway that you want people to have after reading your material, or what action do you want them to take? And if numbers will help support that communication goal or that main message, then it is actually probably a good idea to include them. So if your communication goal is to catch people's attention and raise awareness about a particular issue, a number might be able to help you do that. So let me give an example. Let's just pretend that I created a fact sheet or something about the dangers of lead paint in older homes. And what I'm trying to do is educate people in my community that lots of kids in the community are actually at risk. So I could say this: in any town, many children live in homes built before 1978. And 1978 was the year that the government banned lead paint for consumer use. So that's the significance there. But okay, so that sentence is okay. So I know that there are many children in my community that live in those homes. But check out this version. In any town, 1 in 4 children live in homes built before 1978. So I think that 1 in 4 actually really gives a different feeling to this sentence. That's the only change between the two sentences. It's not as vague as many. It's not vague at all. Actually, it's very specific. And so it's really making this concrete and helping people picture how many kids are affected. At Communicate Health, we've actually done some numeracy research with people who have limited health literacy skills that showed that when we use frequencies like that, like 1 in 4, it really helps people visualize something. So in this case, they might picture 4 imaginary kids and think, oh, wow, one of them lives in a home built before 1978 and could be at risk. And that helps people understand that and really picture that 1 in 4 is actually a lot, right? When you're talking about a whole community. Before we move on, I do just want to caveat this tip. I know it says, instead of this, do this. But for this particular tip, the point is really to keep your communication goal in mind when deciding whether to include a number. I'm not saying that every time you're communicating about risk like this, you must include numbers, but just carefully think about whether doing so will help you achieve that communication goal. So our second tip is that when you do use numbers in a health material, you need to provide context for those numbers to help people understand what the numbers mean. And that context can be words or more numbers, which might sound counterintuitive, but I will explain why in a minute. So context in the form of words might be something like, every year more than 600,000 people die of heart disease in the United States. That makes heart disease the leading cause of death. So I could have stopped after the first sentence, but when I said that makes heart disease the leading cause of death, I put that 600,000 number in context. In this case, that's a big number regardless, but people don't have the full story or really, taken the full import of what that means until we say that is the leading cause of death. So I also said that context can come in the form of numbers, and ranges in particular can be a really helpful way to provide context. So I could say this, I mentioned the air quality index earlier. Today, the air quality index is at 25. That means the air is safe for you to breathe. Okay, but if I say this, the air quality index ranges from 0, safest, to 500, most dangerous. Today, the air quality index is at 25. That means the air is safe for you to breathe. I think that range is really helpful. Now I know a lot more than I knew from that first example. I know that the index today is way, way down at the bottom of the range. It is nowhere near that top level. It's nowhere near those dangerous levels. In the first example, though, if I just read that, I might have been thinking, well, how big is it? Is the air quality index 0 to 50? Does the switch from 25 to 26 make it, dangerous levels? I wouldn't know. There'd be a lot of unknowns there, I think. So basically, that range gives me a lot more information and increases my understanding. Our next tip is that when you can, it is a good idea to use visual metaphors to help people understand numbers. So here's something I could say. We found that the soil at the park had unsafe levels of radon, but we were able to take steps to clean up the area. In fact, we removed 1 ton of contaminated or unsafe soil. So I know that 1 ton of soil was removed, but I can tell you right now that I have no idea how much that actually is. I know 1 ton equals 2,000 pounds, but what does that look like? Like, did they literally have to dig up the entire park? I have no idea. But if I add something on the end of that that says that's enough to fill a dump truck, now I get it. Now I can picture it. I know exactly how much soil they actually carted out of there because I know how big a dump truck is. Although when my kids were younger, they would have told me that there are many sizes of dump trucks, but I'm just going to pretend for the purposes of this example that that is not true. Anyway, the enough to fill a dump truck line is what we call a visual metaphor. And those visual metaphors are helpful because people tend to make sense of numbers by visualizing things. And in that study I mentioned earlier, we found that when we didn't provide a visual metaphor for people, they often created some sort of visual themselves in their own minds. So if we can do that for them, we are ultimately helping them understand the number and understand the health material. Okay, our 4th numeracy tip has to do with the fact that helping people understand numbers sometimes actually means helping them understand jargon terms that are associated with those numbers and often mentioned along with those numbers. This is that COVID example I think I mentioned earlier. Basically, COVID communications really illustrated why this is so important, especially in the earlier part of the pandemic. People were hearing all sorts of terms that they knew little, if anything, about before the pandemic. For example, if I were to say, last week, Ohio had a 20% positive test rate. Epidemiologists, for example, understand what that means, but lots of people do not know what that means, right? And we don't want to take a chance that they are not going to understand our meaning here. So what can I do instead? Last week, 1 in 5 people in Ohio who got tested for COVID had the disease. So that is a lot more clear. I'm actually, in this case, not even using the term positive test rate. There are certainly scenarios, depending on context, where you would want to maybe introduce the term and define it for people, but you may not have to, right? What I did here was, in effect, I did define that term. I just didn't even use it because I don't need to for this particular example. But I'm getting my point across here in a way that is probably much easier for folks to understand. And you'll see that I also sneakily, I don't know if it was sneakily, I changed the percentage to a frequency there. Okay, we're flying through just a few more numeracy tips. So the 5th one is very straightforward, and that is to use numerals instead of spelling out words. Quick switch there. This even applies to, I know lots of us in school were taught that you do spell out words smaller than 10 or maybe smaller than 20, but we use numerals for everything. And that is because people say that numerals really stand out in the text and in a good way. So basically, when people come across a numeral, when they are reading, they say it causes them to kind of like slow down and take note of it, basically. And they may really reflect on that statement in a way that they wouldn't if it was a spelled out word. People kind of tend to read right past it. And because oftentimes if we are including a number in our health content, there is a reason for that. We probably want people to know and understand that number. So we don't want them to read right past it. And one final note here, I do just want to be clear that if you're talking about something in the millions or billions, we're not using a numeral for that entire thing. You can use a, say, if it's 5 million, numeral 5, spell out million, that kind of thing. Okay, our 6th tip is to use simple numbers, which might sound simple, but what does that actually mean in practice? For one thing, and maybe the most important part of this, is to use whole numbers instead of things like decimals and fractions. I do understand that there may be times that you cannot round a number for whatever reason, but most of the time rounding is just fine. And we would recommend it when it's possible, because again, easier for folks to understand. Simple numbers also usually means using frequencies instead of percentages, which I already touched on. So we have 8.3% of children in our county have asthma. 1 in 12 children in our county have asthma. So this is real similar to the frequency we looked at before. That's just 1 in 12 is easier for people to picture than 8.3% really, or probably even just 8%. And this is the last numeracy tip, another pretty straightforward one, which is just that if you can help it, don't ever make people do math. Instead, do that math for them. So that often looks like this example on the screen here, in which I provided a chart for readers instead of asking them to calculate a dose of medicine. This is also representative of the fact that when we're asking people to do calculations, sometimes that might actually be a safety risk. While it might seem like simple math for you or for some people to do that, calculate the 10 milliliters for every 6 kilograms of weight, that is not for some people. And we don't want to take a chance that someone will make a mistake doing that math. We want to make it real clear for them. If your child weighs this much, give them this much. If they weigh this much, give them that much, that kind of thing. So real simple, don't make your audience do math. All right, so those were our numeracy tips. I have just a quick activity for you before we move on to the data visualization part of today's training. Basically, I have 3 real short bits of health content. Each is just 1 or 2 sentences. They include numbers, and I'm going to ask you to make a revision so that this content aligns with these best practices that we just talked about. So you can put your answers in the chat. I will be watching that. You can either make the revision or you can just say, oh, I would include blah, 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 whatever you want to do. So we'll just dive right in here. So the first one is, a serving of meat is about 4 ounces. So you can put in the chat how you would rewrite that, or say, if you don't want to do the actual rewrite, you can say, I might include XYZ. See if anyone has thoughts here. Compare it to the size of your hand. Yeah, what does 4 ounces of meat look like? Love it. That's right. So this is a great example of when it would be helpful to provide a visual metaphor, because I have no idea what 4 ounces of meat looks like. So what we want to do is come up with a visual metaphor that we want to talk about something common that we think our audience, or we feel confident our audience knows. So I said here, that's about the same size as a deck of cards. That's kind of a common visual metaphor you see for 4 ounces of meat. So yeah, great thinking there. We want a visual metaphor. All right, let's try another one. About 2.3% of people will be diagnosed with melanoma during their lifetime, and the average age at diagnosis is 65. What might you do here? You know, I stuck 2 numbers in this example, so anybody? I mean, I can tell you, but would love it if somebody, okay, change percent to fraction, definitely, or frequency, yes, 1 to 50, great. I don't know if you did that math in your head, if so, I'm impressed. And change 65, right, exactly. So nice thinking. So yeah, about 1 in 50 people will be diagnosed with melanoma during their lifetime. Average age of diagnosis is 65. Another thing I did here was separate that into 2 sentences. I'm not sure why that all needed to be 1 sentence, and depending on context, those 2 things maybe shouldn't even be together, but we don't know that for the purposes of this activity. One last one, your triglyceride level was 350. That's an unhealthy level. What would you do here? And of course, if this were a full health material not taken out of context, I would also give people actionable tips for getting to a healthy level, that kind of thing. Yeah, give a range. Exactly. In the interest of time, I'm going to go ahead and just show you. But yes, so anything between 200 and 499 is considered unhealthy. Again, that's one of those things. If someone's level was like down at 205, I think that's actually useful for them to know they're very close to the healthy range, right? They're not there's more danger the higher you get, and we'd want to give all that context as well. But anyway, yeah, giving a range here is the key point. So, and I'm also seeing here, I think maybe a lot of the chats were just going to the panelists. So sorry if some of you weren't seeing that and you're wondering if I'm just randomly saying things out loud, but people were putting answers in the chat. But anyway, that is what I have for you about numbers. So thanks so much for participating in the chat, folks. And I'm going to pass it on to Fred for the data visualization part of today's training.
Thank you. So now that we've learned about numeracy and communicating with numbers, let's take a closer look at some data visualization techniques and best practices. So, but first, before I dive into that, I quickly want to touch upon how data visualization and health literacy are actually connected. So we're going to do another quick reflect and share. If you could share in the chat box some examples of the types of data visualization you might see in a health material. So when it comes to communicating health information and numbers, charts are obviously a prime example, and we'll talk a little bit more about them next. But Andrea, do you mind going to the next slide? Oh, actually, that's not what I have as the next slide, but that's okay. Just keep this one up. So other types of data visualization include things like charts, maps, infographics, dashboards. So maps are great for showing regional or location data. There it is. Thank you. Infographics are a great way to combine visually interesting illustrations to communicate the data. And dashboards are often made up of different types of charts, maps, or other visuals kind of combined to communicate one or multiple messages. So anytime you communicate with data or numbers in a visual format, you're essentially using data visualization. And how does that data visualization actually affect understanding? How does it help people make sense of the data, essentially? So basically, it comes down to the fact that visual aids help everyone, but it helps especially those people with limited or low health literacy skills. It helps all of those people understand the health information communicated. So visual aids can make materials appear easier to read. They can reinforce the main message. They can help people remember information, and they can help reveal patterns and trends. And a great example of this last bullet is John Snow's map of cholera deaths in London. So what happened was John Snow created a map to show how cholera deaths were clustered around and connected to the Broad Street water pump in 19th century London. And this map was hugely influential, not only in addressing the cholera outbreak that was going on, but it also changed public health interventions and epidemiology forever. It's actually often cited as one of the first times data visualization was used in public health. And I think it's just such a great example of the power of data visualization, because seeing the data on a map really help people make those connections and help people understand how all these deaths that were happening, all these people that were getting sick, were actually getting their water from the same pump. And that's where the problem originated from. So you might be interested in hearing how you can use data visualizations in your health materials, but you might not quite know where to start with that. And a key place where I always like to start is by getting to know the data. Because in the end, the data, the type of data, really determines which visualization fits best for your purpose. So things like the type of the data, the scale or the level of measure, your communication purpose, all of those things influence which type of data visualization might be best for your purpose. So in this example here, we see that the results of a CBS poll are being communicated. And there is a few things that are problematic with the way these numbers are communicated. But if you look at the example on the right there, the big problem is that we're looking at a pie chart. And that pie chart shows a few different numbers, they're percentages, but they don't add up to 100%. So it just doesn't make sense to put percentages in a pie chart when they don't add up to 100%, because it just doesn't make sense. Each of those slices don't amount to a nice circle or a hole. And that's why you wouldn't use a pie chart in this example. And I put the data in a bar graph, as you can see on the left, which makes it a lot easier to see how the different pieces are connected. It also doesn't set the false expectation that this data adds up to 100%. And it just shows you side by side, this is the situation today, this is the situation last year, and this is what it was in 1997. So simply replacing that pie chart in the screenshot would have made this a lot easier to interpret. So we saw in the chat that when asked for some examples of different types of data visualization, the first one that came up was bar graphs. And that's not surprising because bar graphs are everywhere. And I think that's in part because they're very versatile and robust. They're great to illustrate comparisons, and that just happens to be something we need to do a lot in health communications. And when done right, bar charts are really easy to interpret. You don't often cause confusion, unlike some other formats we'll talk about a little bit later. They're usually really easy to read and interpret. So bar charts can be stacked to show parts of a whole, similar to a pie chart, or they can be combined with other data visualization techniques as well, such as lines or points. And in this example on the right here, we've got a bar chart, but it actually integrates a line that shows where the target is for these values. So you can easily see each of the values are actually above the target. So that's how you can combine different types of data in a bar graph. One thing to look out for with bar graphs is that the y-axis always needs to start at 0. And when you're showing a percentage, you should also just go all the way up to 100%. And that's important for a few reasons. The fact that the axis needs to start at 0 is important because if you don't do that, the relationship between the bars gets skewed real easily. And the reason why a percentage bar graph should really go to 100% is because otherwise you might falsely give the impression that a value is really close or really far from 100% when it isn't actually, when that's not actually the case. So for example, if you have a bar chart and you only go to 60%, but you have a value that's at 58%, now you might at a glance interpret that as, oh, that's actually close to 100%, which it's not because your chart is topping out at 60%. So you got to be careful with that. But I think as long as you keep a few best practices in mind, especially the thing about the axes, you will be able to create some really powerful and easy to interpret bar graphs. Another very popular chart is a line graph. So because you can easily stack and overlay lines visually, line graphs allow to show a little bit more data points without taking up as much space as a bar graph typically does. So line graphs are really great to show or highlight trends, and they also allow for easy comparison between groups over a range of time. In this case, it's a little less important for the y-axis to start at 0, but you really have to be careful not to skew the aspect ratio of the chart. So oftentimes it's just a good best practice to still start at 0 to make sure that you don't accidentally make the chart either too narrow or too tall. Actually, too narrow would be too tall. So you don't want to skew the aspect ratio of the chart. Usually a 2 to 3 aspect ratio is a good guideline, so that the peaks and the lows of your trend line don't look disproportionately high or low. And one important thing that you really do need to keep in mind is that you can never, and this also goes for bar graphs, but you can never change the scale of either of your axes as you progress. So for example, if you have your axes cut up in 10 equal parts, each of those equal parts need to represent an equal range of values. You can't halfway through the chart become more granular or less granular, because that completely skews your data, and that would be very misleading. And you'd be surprised how often that actually does happen, sometimes by accident, but sometimes people are actually actively trying to misrepresent the data they're visualizing. And one last thing I wanted to point out is to be careful not to overload the chart with data. More than 4 lines on a trend line or a line graph can start to make it hard to read the graph, because there'll be a lot of overlap and things will be very close together. So once things start to get a little cluttered like that, once it becomes hard to read, you might want to consider splitting up the chart into separate charts, multiples, or you could consider a different type of data visualization altogether. So points are another great way to communicate data, especially for certain types of data. They're really good when you need to compare unique values, or when you need to layer types of information on top of another type of chart. So for example, you might have a regular bar chart, and inside each of the bars, you might indicate the median value for that data point with a point inside the bar. Or you might have a color coordinated map that includes points on the map to show specific locations or hotspots, things like that. And one benefit of using points is that the scale issues that we talked about for line graphs and bar charts become less of an issue. So in a lot of cases, it will be fine to not start the axes at 0. But again, like I said before, the data really drives the data visualization. So you have to always be careful not to misrepresent or distort things if you don't start your axes at 0, or you don't go to 100%, things like that. So points are especially helpful to show distribution or correlation. So on this slide of variables, and it's shown in something that we call an opposites or a quadrants chart. And that shows the different data points, complex and simple on the one hand, and good versus bad on the other hand. So we've got those 4 different extremes of the chart, and we can easily distribute the points within that to really show the correlation and the distribution. So another example that was mentioned in the chat were pie and donut charts. And we already saw an example of a pie chart that was not great. But I did want to dedicate a whole slide to them because they are still pretty popular, pie charts and donut charts. And just, for full clarity, pie charts are circular charts that show the data in slices of a pie. And a donut chart is similar, but just has a hole punched out of the middle where you can put some additional data. And like I said, these charts are very, very popular, but they are actually quite hard to get right. There's a few reasons for that, but one of the big reasons is that the only thing pie charts are particularly good at is to show how parts of a whole add up to 1 or 100%. So if something is a whole, how is it sliced up and how are the different pieces combined to make that whole? And when you think about it, you'll find that more often than not, that's not really your main message. Most of the time, people are actually looking to understand how the data is distributed or how it's related to each other, not necessarily that it all adds to 100% or it all adds up to a whole. So when that's not your main communication goal, you're probably better off with a different type visualization, like a bar graph or something similar. And because pie charts are so narrowly applicable, and they're also easy to get wrong, as we saw in the example a few slides back, some data visualization experts actually recommend against using them altogether. I wouldn't go that far, but I do want you to keep in mind, if you do decide to go with a pie chart or a donut graph, I want you to keep in mind that research does show that people aren't particularly good at interpreting these charts. For most people, it's really hard to kind of interpret the angles and the areas of the pie and correlate how that represents the data. That's just something our brains are not very good at, and that's something to keep in mind when you do decide to go with a pie or donut chart. Be careful about that because that could be hard for your audience to parse out. And that last point, how certain types of visuals are just harder for people to interpret, is really important to keep in mind, because options for data visualizations and different types of charts are near infinite. There are so many different ways you can represent data visually and put it in a chart, that it becomes really important to kind of take a step back and make sure that you're not just picking one of these less common charts because they maybe look visually more interesting. Your main communication goal should still be to communicate the data and help people make sense of them. So that's really the reason why the classics we just discussed are so popular. They're tried and true, and they're some of the simplest types of visualizations. And when it comes to communicating data, especially in a health communication context, simple is usually better. Complex charts or very complex infographics, they can be hard to read or interpret, but even worse, they can make it so that the information is misrepresented or misinterpreted. And that's obviously dangerous, especially in a health communications context. So before we wrap up the section on data visualization, I briefly wanted to mention the importance of accessibility. So because data visualization is visual by nature, you really need to pay close attention to things like color, color contrast, making sure that the things aren't just represented by color, but that there's also another way to see or interpret the data. Alternative text or alt text is very important. You might need to provide captions to make sure that the information is accessible to people that aren't actually seeing the visual. So things like labels, titles, is all very important. And when possible, you should also just provide a way to access the data in a simple tabular format. So just a simple table of the data. While it's not, it will lose some of those advantages that we talked about in terms of making it easy to visualize and interpret. It might be easier for some people to consume the data in a table format. So when possible, it's always a good idea to include that alternative as well. So let's do another activity. I'm going to share a set of data, and we're going to pick a type of chart that we think would be a good way to visualize these data. So again, you can just type in the chat. We've got percentage data for adults who have health insurance in 2024 to 2026. I picked dates in the future because I made up these data. These are not real data, completely made up, completely dummy data. That's why I picked dates in the future so we don't get confused about that. So we've got 3 categories of data: private insurance, public insurance, or no insurance. And we've got 3 years of data to communicate. And again, they're all percentages. So which type of chart do you think would be best suited for these data? Bar graph each year on the y-axis with the 3 variables in different colors. Yep, very good. Line chart, bar chart, bar chart. Okay. In the interest of time, I will move us along, but these are all great answers because the catch here, it's not really a catch, but there's a tiny catch, is that there's actually 2 great ways to represent this data. It could either be a bar graph or it could be a line graph. And the way you would determine which one of those 2 is best suited for your situation is really by focusing on what it is you want to communicate. So if you want to communicate the trend of how over time the different categories of insurance have changed, then it might be best represented with a line graph or a line chart. But if you want to emphasize the difference between the categories within each year, so how is private different from public or different from no insurance, then you would go with the bar chart. So again, the main message is the data really drives which type of visualization is best suited for your needs. So if you've attended any of these other sessions by Communicate Health, you've probably heard this before, but at CH, we always test and assess our materials. And we don't have much time left today, so we won't go into too much detail, but maybe Andrea, you can please tell us a little bit more about testing.
Yes, if I can unmute. And yes, we will go over these last couple of slides really quick. So if you can stay with us, I know you all are going to take like a post-test or a post-training test. And then Fred and I can stay on after that for questions if anyone has any. But yes, testing health materials, key point here is that the best way to know if your audience understands the information you're giving them is to ask them. So in other words, test your materials with your audience. If you have the time and budget to do formal audience testing, that's great. We recommend it. But if you don't, even sharing your materials with 1 or 2 people in your audience to get their feedback can be really helpful. And these are the types of questions you want to ask, or you want to ask questions to find out these types of things, how well people understand the information in the material, what they like, what they don't, what they think is helpful, what they think is missing. And because this training is about numbers and data visualization, I just want to point out that when you are testing your materials, be sure to ask specific questions that get at how well people do or don't understand the numbers and data visualizations that you are sharing with them. And we have this resources slide, and the first few resources on here get at the fact that it is also a very good idea to assess your materials yourself with an evidence-based assessment tool. And we have 2 examples of ones that we sometimes use at Communicate Health, the CDC's Clear Communication Index and the Patient Education Materials Assessment Tool. Those are both ones that you can use to make sure your materials are following best practices in health literacy and clear communication. And Fred, you want to talk about the last couple resources?
Yes. So I linked digital.gov here, which is it's a website, government website, obviously, that has a lot of best practices for things like user experience, information architecture, design systems, all of those. And they also have specific tips and resources for data visualization. So I linked to that website as kind of like a good starting point. There's tons of resources, especially just more general data visualization resources out there. But this digital.gov website is a good starting point. And then I also added this book here, Visualizing Health and Healthcare Data. This book is it's a great data visualization book that really dives into the specific things that are important when you're talking about health and healthcare data and visualizing that kind of data. It's a great book, and I highly recommend it. And then lastly, I want to give a plug for our very own We Heart Health Literacy blog or newsletter. You can access it as a blog on our website, or you can subscribe to the newsletter, which will give you health literacy tips in your inbox every week. And a lot of these things are obviously related to data visualization and numeracy, and just in general, all kinds of health literacy best practices and tips. So I highly recommend that you subscribe there and get some fun weekly reading in your inbox.